All right, folks, come on in. We're going live again on Facebook and YouTube. Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Today, Brad, we're going to talk about 7 simple exercises you can do for shoulder pain that really work.
Right.
Now, this works for impingement. This works for rotator cuff tear. Well, it'll prevent tears.
Sure.
And it'll work for like a tendonitis, and arthritis.
Sure.
All those things.
A lot of shoulder pain going in there.
If you are new to us, by the way, and you're watching us on the rebroadcast, I'm getting a little violent here.
Oh, kidding, Bob.
On YouTube, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, and pain-free, and we upload every day. Subscription button here or here. Yeah, he's got a skeleton arm there. And if you're not, if you're on Facebook, give us some love. Give us the hearts and the likesies, and if you're not on Facebook, get over there. I mean, man, we're going to be giving away some of these balls, Brad.
Right, exercise balls.
Yeah, that's coming up in a day or two here. Probably we're going to give away 3 of them. They're from Can Do.
Right.
I can do it, baby. All right.
So, what are we talking about again? Oh, the shoulder.
Yeah, we're talking about in 80% of the cases I see, Brad. One of the problems is that the upper bone here, the humerus, has moved forward in the socket a little bit.
Right.
And why has that happened? Quite often because of posture.
Right.
As you're sitting like this, look how I round forward. The muscles get tight here, and the shoulder gets internally rotated.
Right.
It moves forward in the socket and it tightens up, and it pinches on there.
Right. So this ball on the end of your humerus, the head of the humerus, is not in the socket where it's supposed to be, which can lead to impingement, leads pain, and all kinds of things from bursitis, tendonitis. All things can arise just from poor posture.
Yeah, it's amazing how that one thing leads to all these problems. It leads to tendonitis. It can lead to rotator cuff tears.
Sure.
It can lead to the impingement. So one test that we always show people is that you stand up and you see how your thumb's oriented. If you're standing here and you're straight, the thumb should be pointing straight ahead. But if you're kind of, got a rounded shoulder and maybe a little forward head posture, look how my thumbs are pointing towards each other.
Sure. So this is going on right here.
So right now across the world, people are standing up and they're seeing their thumbs are pointing towards each other, Brad.
And everyone's going like this.
So let's start off with some exercises that are going to help correct this, Brad.
Okay.
So we're going to do things that stretch it, strengthen, all these things, right? Yep, he agrees. All right, let's first start off with, these are the exercises that you want to do throughout the day. You can do them every hour if you want.
They don't take any special equipment. You can do them while you're sitting at your chair.
So we're going to start with shoulder squeezes, Brad. We're going to start just squeezing your shoulder blades together. So you can see I'm giving the front view, Brad's giving the back view. See how he's pulling those shoulder blades together. Now the shoulders, the blades, they provide the base for the shoulder. They're the core of the shoulder. If the muscles around here aren't strong, your shoulder is going to be out of whack. The muscles of the shoulder are going to be out of whack. So you want to make sure you're doing these. I'm always amazed, Brad, when I'm starting to get shoulder pain, I just do a couple of these.
Work on these. Yep.
And a lot of times that takes it away.
Sure.
Now that's the beginning part of shoulder pain, but I mean, once you're deep into it, it's going to probably take a little bit longer than that. So good 10 or 15 of them. And you can do them pretty subtle. Sometimes people do this one, they go this, and then they hit the road jack.
Sure.
Hit the road jack.
And that actually gets the external rotators of the rotator cuff, which is helpful. If you're a therapist, you know exactly what we're talking about.
All right, next one, Brad, is a technique by Brian Mulligan.
Okay.
Again, we've showed this one many times, but you can do this with there's a lot of different ways you can do it. You can do it with a countertop. You can do it with a chair. There's a lot of different. I'm watching that one, Lonnie. Don't worry. So you're going to go ahead and put your hand on the countertop or on the chair, and I'm going to push down. So I'm pushing down. So if the chair wasn't there, I'd be pushing down like this. And you're going to push down the whole time. And what that's helping do is push the head of that bone back into place.
Right.
So I'm pushing down. I don't ever let up. I'm still not letting up, Brad. I'm not letting up. I'm going to go all the way back up again.
Yeah, and if your chair, depending on your chair, I was just about ready to hold the chair because it might even want to tip like this.
Yeah, that's why you may want to do it on a countertop.
Right.
This is actually a good solid chair.
Right.
But it won't work for a lot of chairs. Yeah.
Sure.
It's a good point, Brad. So I'd like to see you doing at least 5 of these, Brad, and it should be pain-free.
Right.
If it hurts, go as far as the pain will allow. If you can only go this far, fine.
Right, good point,
And
Bob.
then eventually you might be able to go further and further, and that's going to help set that in. This one has been very helpful to a lot of people. Again, you can do this one frequently if you want. You can do it every hour if you want.
One nice thing you can do with this is, if you can go this high and then you do 5 or 10 of those and you can go up this high without pain, it's a clear indication that exercise is doing the correct thing.
You want to show the Heineck method, Brad?
Oh,
Brad just developed this method. This is a new method of doing that same exercise. If you have a ball, we do recommend you get one if you don't, because we have a lot of videos on how to use the exercise ball. Brad just did one on doing an entire program for the shoulder using the exercise ball.
Exactly. Bob, it's the beauty of the ball.
That's right. He loves that line.
You bet. So what we're doing here is now I'm going to squish down into the ball. And that's how you know you're going to do it right, because you're squishing into the ball, making a little indentation in there. Now, the beauty of the ball is you can still go like you were doing.
Mm-hmm.
Now, this ball is pretty big. I would probably use a smaller ball, unless my
Or
shoulders.
put the ball lower,
Right.
lower surface.
Or I could just use this small ball. And see, now my shoulder is lower, so this may be the one to use. But then you can see I'm doing the exact same thing, but this is the option you have with the ball. Pushing down instead of moving your feet, we move the ball forward while maintaining that pressure down, and it's just another way to go about
And it
it.
rolls down the arm, doesn't it, Brad?
Right, yeah, you don't have to keep your hand and try to roll your hand around. Sometimes my patients have a tendency, and I'll let them know, just let it roll right up the forearm and then back. But again, it should, if you did it like this and it hurts and you push on the ball, no pain, then you know you're on the right track and it's going to work well.
By the way, Bob and Brad have a preferred list of products that we really love, and I'll put that down below in the description and on YouTube if you want to see it. And the ball is one of them.
Right, and that way you know you're getting a good quality ball. It's nothing that won't be happy with.
Next one, Brad. This is an easy one. This is the lazy man's exercise right here.
That's why I like it.
What you're going to do is you can either get a foam roller, which again, the one we really like. This is a kind of a different one because it's a little softer one, isn't it, Brad?
Yeah, the density is a little soft, which makes it more comfortable, particularly for this exercise we're going to be doing.
And that's on our preferred list also down below. But if you don't, you can just take a bunch of beach towels or towels and wrap them up like this, put a little duct tape on them, and you can go ahead and you're going to create your own little roll. And I'm going to put it between the shoulder blades. So I'm putting it, Brad's showing on him. And what that's going to do is that's just going to open things up. And, it's the end of the day. You just lay on that, and it just opens everything up, stretches the chest, gets the shoulders in the right position, and you can just lay there. And this is a good way to unwind at the end of the day, isn't it, Brad?
Right, and this is the beauty of gravity, because the gravity is doing the work. You're tired. You don't want to think about something stressful. You just relax, let the shoulders go down where they're supposed to, let the joint, that the humeral head go where it's supposed to, and relax.
Yeah, and this is good for thoracic outlet syndrome too.
Oh yeah,
That's almost a must do for that one. You can show on that real quick, Brad.
now the thing about the roller is you see it's quite a bit longer than this, and actually I find it more comfortable than this. That works well. I think this works better, but again, you have to purchase one the other way. You don't have to. It'll still be okay. And just lay on here and just relax. And this does a little bit of balance issues to it. It's not hard to balance on it, but that's incorporated.
It really stretches everything out.
Yeah. And also, I like this because you can put your head on here, so it also works on posture of the neck itself. So I'm actually can do some chin tucks.
Yeah, some people are actually going to probably can't get their head down there, Brad.
Right. If that's a problem, then you may need to put a pillow there so it's comfortable.
They also have this little device that I guess they send along with the Pro Roller Arch.
Yeah, that's a nice. There you go.
Device.
So you would only use that if this isn't comfortable, but with this you can still do chin tucks. I'm just going to move forward, move my body down. Oh, I just cavitated, Bob.
That means he cracked his back. So let's move on, Brad.
Oh, sorry, Bob. Having fun.
He was getting a little uncomfortable there. So next one. Now the next exercises, Brad, are one you will not do all these in the same day.
Right.
You're going to pick one, and if that one starts going well, you go to the next one. So you start off with this one, which is shoulder extension. So you're going to need a broomstick or some type of handle, a yardstick, something like that, a cane. And you're gonna start, and you're gonna be working on this thumb is gonna be on the top side, and you're just gonna grab the end like this, and you're gonna work on extension like this. And again, this should be pain-free. So if you can only go this far, that's where you start.
Sure.
You don't go any further until, but eventually, when you can do this to the point where it goes way back, then you'll progress to the next exercise.
Right. And if you look at me from this profile view, it's going behind you, not out like this. So that's important. It is an extension. We call this abduction when it's to the side.
If you're at work, you can put your hand on a countertop and bend down like this and stretch back like this. It's a little bit difficult, but it does, you know, it works in a pinch.
Yeah.
If you can see Brad over here on this one.
That countertop, actually what I'll do, just to make it a little bit higher, I'm going to put that there and there. Then I don't have to squat very far, and I still can get to the point where I get that stretch.
By the way, as we do with all these live videos, we try to get through our program first, and then we start answering questions.
Sure.
So we'll do that at the end. Next one is shoulder. So once that one is going well, then you're going to do shoulder internal rotation. And there's a lot of different ways you can do this. One, you can just take your broomstick and go over the top like this, and you're going to grab down below. That's kind of a tough one to do, Brad.
Yeah, but once you get a hold of it,
It will pull up. Because a lot of you are not going to be able to go any further than this.
Right, yeah, because if you could do this, you probably don't have a shoulder problem, but it's still good maintenance.
So you can take a rolled sheet. Again, we're going to give you lots of options here. I hope you hear me because I'm turning away from the microphone. But Brad's showing this is a nice device. It's called the stretch out strap. It's on our preferred list also. But you can take a towel and throw it over your shoulder like this. And this works really good too. You can just pull up and you're going to, again, work your way up further and further.
We'll do that again, Bob. I just want to point out one reason why the stretch out strap works good, because he literally has to grab a hold of that towel, which inherently increases some of the tightness, and you won't get as good as a stretch because you can't relax as well.
So he's got a loop here that helps pull it up. Now you do this with your belt sometimes too, Brad.
Yeah.
So
do you want me to show?
I don't know, Brad. I don't want to take any chances here. So eventually, now you'll find usually your sore shoulder will probably go up maybe this far, where your good shoulder goes up this far. So eventually, once you're about up to that, then you're ready for the next one.
And now this one in particular, don't put, if you start to get sharp pain, you need to stop. It's not ready for it yet. We just need to stretch it out gently. It should be reasonably just a gentle stretch pain.
All right, the next one, Brad, is once that one's going well, now you're going to start by just laying down. You're going to take your cane and your broomstick, and you're going to start working on these, going straight forward like this. And you can use the one arm can help the other arm, Brad.
Sure.
And I'm just go further and further like this.
Now, if you don't have a cane or a broomstick, you can just go to the hardware store and pick up a piece of PVC pipe for $2.
Sure.
That's what we use here. That works really well.
And then the final one, Brad, is you're going to go ahead up to the wall, and you're going to do either with a ball or you're going to do with a towel.
Sure.
So Brad's going to show this. Get the skeleton out of the way. Sorry, I got to move this camera around here too. Catch Brad.
Yep.
There we go.
So, you know, hopefully your wall's a little bit on the slippery side. You can just take a towel and then just go up if you need the help with this hand a little bit. And you're just going to help bring it up and down, bring it up till you feel stretch. Any sharp pain, it's too early. You don't want to push into sharp pain. You're going to make it worse. Up until you feel a stretch, maybe a little mild stretch pain, then come back down. And as time goes on, day by day, you'll get stronger, and it'll stretch out, and it'll work out well, particularly if you did those other exercises first. You can use the ball. I like this because you could use both hands. So this would be my good hand. I'm going to put it on top of my weak one, and it's going to assist so that it makes it easier. And as the weak one gets stronger, then I'm going to take that one off. And then I'm going to work it up just as far as tolerated. We're not going to push into sharp pain and make it sore. We're just going to gently work it, gently strengthen it. And you can roll up if it feels good and it feels like a good stretch. When you get up in here, you can roll right up your forearm towards your elbow. And that works out real well. All right.
All right, Brad, someone asked us if we have an Amazon preferred list. And that's what I was talking about. Yes, we do. That's, I don't know if it's linked below yet. I'll make sure it's there by tonight. But that is our preferred list of products, and that was a good question.
Sure.
So, and then someone was talking, I didn't catch the string of conversation, but they were using, remember we did a video on using those pool noodles? I think we were using them as a back support.
Right.
But they were using it at night in the bed.
Oh,
so,
for lumbar support?
Yeah.
Sure.
So again, by the way, we can show real quickly, Lonnie, if you want to show me a couple pillows, or I can grab a couple pillows. You know, our recommended sleeping posture is one that you don't sleep on. You know, if you have a painful shoulder, don't sleep on it.
Right.
I mean, if you have to, if you feel like you can't sleep any other way, we recommend you put the two pillows like this, and you put a third pillow or a smaller pillow right here, and you create the groove here or the canal, and now you got room for that shoulder to give it some relief. If that doesn't work, or if you can sleep on the other side, the side that it isn't harmful, you'd want two pillows underneath your head, because you need lots of pillows. And you have two pillows underneath your head, but you take one pillow here and one pillow here, and that gives that arm support all night long. It's really important with shoulder pain to keep that shoulder supported all the time. Even when you're sitting, I'd like to I tell people to take a couple pillows and put it like this, and let that shoulder relax and rest. Lonnie, did you have a question?
Is that good for preventing frozen shoulder too?
Frozen shoulder is a weird phenomenon. Lonnie said the question from Facebook is, will this prevent frozen shoulder? Frozen shoulder, they don't really understand why it crops up. It's just, it's an inflammatory process.
Mm-hmm.
I don't know that you can really prevent it. Sometimes it happens after injury.
Right.
And sometimes it just happens sporadically.
Sure.
And unfortunately with frozen shoulder, it lasts a certain amount of time no matter what you do. You can make it a little less extreme, but it's got to run its course.
Right.
It's got the freezing stage, the unfreezing stage. So,
Right. And we do have a video on the exercises that you can do to help manage it.
yeah. Did you have a question, Brad?
We had a gentleman ask about, can some of these be done from a wheelchair? In other words, can't stand up if someone who's in the wheelchair.
Oh, absolutely.
So I don't have a wheelchair handy here, but it's going to be the same thing. For instance,
Brad, come a little more this way.
oh, there we go. Of course, sitting down for like the mulligan technique, then you probably wouldn't need to use the ball, and you'd probably just need a smaller ball to put on the table.
Well, you could have the ball in front of you.
Oh yeah, right there. Let's grab it one. That's a good idea.
But the other one, I mean, you certainly can do the shoulder squeezes together.
Sure.
That's a really good one to do when you're in a wheelchair, because wheelchair posture tends to be bad.
Sure.
So
Yeah. So again, squeezing back here, and hopefully, if you have supports on your wheelchair, that might make it difficult. You may have to come forward if you can, depending on your problems. But you just have to imagine everything to the different height of the chair. And the problem is the chair may get in the way in some of the exercise. If you have removable armrests, that will help a lot to do some of these exercises so that your elbows aren't bumping into
well,
things.
some people were saying they had no sound. I hope we got sound now. I mean, we got an indicator that we have sound.
Yeah.
So any recommendation for Parsonage syndrome?
For which one?
Parsonage?
Parsonage. Lonnie's got a question there, but I'm not sure what it's. Brad's going to take a look at it. I'll look over here real quick to see if there's any other questions over here. Do these exercises work with a torn labrum with no surgery required? I would try some of these with the torn labrum, but again, I'd very much avoid any painful exercises. Again, with the torn labrum, you might often have it that it's a little bit out of socket, so you want to get it in place. But with the torn labrum, you got to be completely guided by pain. I mean, if you do an exercise and it hurts, you can't do it.
You need to keep that labrum in place, let it heal up, give it some time.
It's going to heal.
Right.
Yeah.
To me, that's kind of like the meniscus of the knee. I kind of relate how
Right.
those are.
Exactly.
Yeah. And that other diagnosis, that's a real select diagnosis that we'd have to.
We'd have to do a separate video on. Yeah.
Sorry
So
about
how
that.
often can she do strengthening and stretching? Should it be every day or every other day?
For strengthening, because these are small muscles. I mean, let's say, for example, Brad, we're going to work on one that we really like for the shoulder is external rotation. And you can take just a soup can and you can lay on your side. I had that pillow for a reason,
Oh, I
right?
see.
It keeps taking away my pillows. So you can lay on your side like this, and you can go ahead and go like this, and you're working on external rotation. Now, this is a small muscle. It's really good for helping keep the bone in the socket. But you could do these every day because they're such small muscles. You wouldn't overwork them by, you could do 3 sets of 10. Work up to 3 sets of 10, and you could do those every day. Definitely the stretches, you can not only do every day, you could do them quite often every hour. I mean,
Assuming it feels good and you're not, there
right.
might be some usual situation where it's making it sore, but typically you don't do them, you don't overdo them.
Right.
Do them within reason. Go ahead.
The way Mackenzie recommends, especially working on extension like this, starting with that one.
Sure.
He says you can do it every hour or 5 days, 5 hours or 5 times a day.
Sure. Yeah.
So, anything else?
Let's see.
So here's a question from
Question?
Shukla. While playing cricket, I developed neck and back pain. I cannot move my neck towards right.
So-
And when I move my chin towards my chest, there is a sharp pain.
So a guy the question is, he's playing cricket and he developed some back and neck pain, and now he's having some movement difficulties with his neck. I'm sorry, that's just too specific. I mean, first off, there could be an injury there that you should probably go in and have it x-rayed, so we really can't make any recommendations. Generally with movement, we have you work on the direction that you can move if there's nothing, nothing broken. So if you can't do down and to the side, we have you work to the opposite side and keep working that, and then eventually, hopefully, the other side comes through. So, Brad, anything?
Yeah, someone's asking about the foam roller. Is a half a foam roller work? And yeah, that can work out for this, particularly this exercise we showed. It's even more stable and it does the same thing. So that,
Yeah,
in
I
this
use,
case, it can work well.
I use a half a foam roller myself, to be honest with you.
Oh, do you really?
Yeah, that's
Okay.
all I have at home.
Okay.
Because it is something I use every day. But again, I have a real like for this foam roller because it's a bit softer. It's the first one I found like this, Brad. I don't know if there are other ones, but it's just not quite as hard as the other ones. It's made by OPTP, but again, it's in our preferred list. So, anything else, folks? Glad to take your questions if we're just winding down here.
Yeah,
Brad.
well, there's a number of questions and some of them are a little off topic. There's one about can use elastic bands versus the soup cans.
Oh, of course, yeah. We use elastic bands all the time. I mean,
Yeah, I actually prefer them, but
Yeah,
not
I do
everyone
too.
has them at home. But this is the same exercise that Bob was doing,
doing external rotation, yeah.
and so they work very well. But again, not everyone has one at home, but everyone can do this.
Right.
So if you want to purchase one, or if you're PT, if you're a patient, we just
We give you some stretch bands.
Right, and that's
some,
pretty typical.
Some exercise bands.
Oh, it's kind of
So-
funny going right across
Yeah.
the neck, Bob.
So, all right, folks, we've been running a long time here. We probably should cut her off, otherwise people are going to get angry at us. So, thanks everybody for watching, and please subscribe to us if you haven't already.